Okay, let's get into this. Ever looked at your, super cute new puppy and thought, is that belly a little rounder than it should be?
Or maybe you had that slightly jarring experience with the cat's litter box, finding something that looks, well, suspiciously like cooked pasta.
Exactly. If you've got a dog or cat, especially a young one, chances are you've either worried about roundworms or, dealt with them directly. They are just incredibly common.
Almost universal in puppies and kittens, really.
So today we're doing a deep dive into a whole stack of sources, clinical guides, vet overviews, the works, all focused on these roundworm infections in dogs and cats.
Right?
Our goal here is to really understand these persistent little parasites, what they do to our pets, and importantly, what they might mean for us humans too. We want to pull out the key stuff you really need to know.
Yeah, absolutely. And we'll be focusing mainly on the big three, Toxocara canis in dogs, Toxocara cat in cats, and then there's Toxascaris leonina, which can actually infect both. And one thing that jumps out from the sources right away is that even though we call them all roundworms, they're not all the same, especially when it comes to that human health angle. Understanding the differences, well, it's vital.
So just starting broadly, what are we actually talking about? What is a roundworm infection?
Okay, so fundamentally, it's ascariasis. It's caused by nematode parasites, these round-bodied worms that usually set up shop in the small intestine of our pets.
And they're significant just because they're so common.
That's a huge part of it, yeah, especially in young animals. But the sources really stress they're not just, a minor annoyance. They can cause serious illness, and in really bad cases, they can even be fatal.
Wow. And you mentioned that risk of crossing over to people early on.
Yes, and this is probably the single most important point for owners, I think. Toxocara canis, the dog one, and Toxocara catty, the cat one, are zoonotic.
Meaning they can infect humans.
Exactly. And they're both pretty pathogenic in pets, too,
Yeah.
causing significant disease. But then you have Toxascaris leonina. It's still common, still causes problems for the pet, but it's generally considered less pathogenic. And this is key. It carries eno-zoonotic risk.
Okay, that's a big
A
difference.
huge difference. And another thing the sources point out is that Toxascaris leonina larvae don't do that big tour through the body tissues like Toxocara larvae do. Their journey is much more direct.
Interesting. Now, one source mentioned Ascaris briefly. Is that related, sort of in the same family?
It is, yeah, it's another roundworm, Ascaris procyon, the raccoon roundworm.
Ah, raccoons.
Right, dogs aren't the main host, but they can sometimes get infected. The reason it gets flagged is because if humans accidentally ingest Ascaris eggs, the larva can cause really severe neurological problems, nursisticercosis.
Oof.
Yeah, so different parasite, different main host, but it just highlights how serious some of these larval migrations can be in people.
Okay, so we know who the main players are and why they matter. Let's trace their journey. How does a pet actually get infected? What's the life cycle look like?
Understanding the life cycle is just, well, it's fundamental if you want to control these things. For the Toxocara species, Canis and Catty, it usually starts with adult worms already living in an infected animal's gut.
And they lay eggs.
Tons of them. Unembryonated eggs, meaning they're not infectious right away. These pass out in the pet's feces.
So fresh poop isn't the immediate threat if you clean it up quickly.
Not the immediate infective threat to a new host? No. That's a really crucial point in these sources. The eggs need time out there in the environment.
How long?
Typically about 2 to 4 weeks. Assuming the conditions are right warm, moist soil is ideal. During that time, a larva develops inside the egg, reaching the L3 stage. That egg, with the L3 larva inside, is the tough, infectious stage.
Gotcha. So the simplest way to get infected is just swallowing one of those aged eggs from contaminated soil or maybe licking paws after walking outside. That's the fecal-oral route.
Precisely.
Yeah.
And that works for all the species we're talking about. But Toxocara, well, Toxocara has some other tricks up its sleeve that make it especially good at spreading.
Oh.
So once an animal swallows those infective eggs, the L3 larvae hatch out in the small intestine.
And they don't just hang out there?
Nope, not usually.
Nah.
They go on a bit of a journey. This is larval migration. In young animals, especially puppies and kittens, the main route is called tracheal migration.
Tracheal, like the windpipe.
Exactly. The larvae burrow through the intestinal wall, get into the blood, travel first to the liver, then get swept to the lungs. In the lungs, they break into the air sacs, get carried up the airways,
And then coughed up.
swallowed, and then they finally mature into adult worms back in the small intestine.
That little cough you sometimes hear in puppies. It could actually be these larvae on the move.
The worming cough, I've heard that term.
Wild.
It is pretty wild. Now, in older animals, or maybe if the initial infection isn't massive, the larvae often take a different path. Somatic migration,
Somatic, meaning body tissues.
right? They still get into the bloodstream, but instead of heading mainly for the lungs, they travel out to various body tissues, muscle, kidneys, brain, even the mammary glands, and they form little cysts and just go dormant.
Dormant larvae just waiting in the tissues. That sounds like a ticking time bomb.
It kind of is, especially for Toxocara canis in female dogs, because those dormant somatic larvae are the key to transplacental transmission.
Across the placenta,
That-
before birth.
Yes. Late in pregnancy, hormonal changes can trigger these dormant larvae to reactivate. They then migrate across the placenta and directly infect the developing puppies in the uterus.
No way. So puppies can literally be born already infected.
Born with larvae already in their liver and lungs, yeah?
Uh,
These larvae then complete that tracheal migration soon after the pup is born. It's the main reason T. canis is so incredibly common in young puppies.
that explains so much. Just mind-blowing.
It really is. And there's another route, too, transmammary transmission, through the milk. Those reactivated larvae can also move into the mammary glands during lactation and get shed in the mother's milk for several weeks. So, puppies and kittens drink the larvae while nursing. This happens with both T. canis and T. canici.
Wow. Okay, so swallowing eggs, infected in the womb, infected through milk. Any other ways?
Yep, one more important one, paratenic hosts, or transport hosts.
Meaning?
These are other animals like mice, rats, rabbits, birds, even earthworms that might accidentally eat the infective Toxocara eggs from the soil. The larvae hatch in the paratenic host and migrate into its tissues and encyst, but they don't develop any further.
Okay.
But then if your dog or cat hunts and eats that infected mouse or bird,
Ah, they swallow the encysted larvae.
exactly, and those larvae get released in the pet's gut and usually develop straight into adult worms, often skipping the whole migration journey within the pet itself. This is a really common way for adult pets, especially hunters, to pick up new infections.
Makes sense. So that covers the complex Toxocara life cycle. What about Toxascaris leonina again? You said its journey was simpler?
Much simpler, and that's the key to why it's less harmful overall and not zoonotic. Toxascaris leonina larvae do not do that big migration through the body tissues.
No liver-lung trip, no somatic waiting game.
Nope. They hatch in the small intestine, might burrow into the intestinal wall briefly, but then they pretty much just mature right there into adult worms. Transmission is just fecal-oral or through those paratenic hosts. Much less drama.
Okay, so once these worms are established, either the migrating larvae or the adults in the gut, what does the pet actually experience? What signs might an owner see?
Now, what happens to the pet? It really depends, on which worm it is, how many there are, the worm burden, the animal's age, its immune system.
Yeah.
Lots of factors.
Is it the migrating larvae causing the main issues or the adults hanging out in the intestine?
Both can cause trouble. That larval migration, especially the tracheal route with Toxocara, that can cause the coughing, maybe some mild pneumonia-like signs as they pass through the lungs. But the most classic signs people notice, those often come from the adult worms in the gut.
Because they're stealing food, basically.
Exactly. They're competing directly with the host for nutrients, right there in the intestine. This is a huge deal for growing puppies and kittens. It leads to poor growth. Maybe they don't gain weight like their litter mates. Their coat looks dull and unhealthy.
And the famous pot belly.
Ah, yes, the pot belly. That's a really classic sign, especially in youngsters with a heavy load of worms. It's partly the physical mass of all those worms taking up space, and partly inflammation and maybe some gas buildup they cause.
Can it get really bad, like dangerous?
In very severe infections, yes. A huge mass of worms can actually physically block the intestine. That's an emergency. Or even cause the intestine to rupture. That's life-threatening, obviously. You'd see signs like severe abdominal pain, vomiting.
And that vomiting, that's when you might actually see the worms come out.
It is, yeah, particularly with Toxocara. Owners sometimes get quite a shock seeing these adult worms, either in vomit or feces. The sources describe them pretty well, like off-white or yellowish spaghetti.
Spaghetti, lovely. How big are they?
They can range quite a bit, maybe 4 up to 18 centimeters long, so pretty noticeable. And just their presence irritates the gut lining, which can cause vomiting and diarrhea too. The diarrhea is often sort of soft, maybe mucoid.
So it definitely sounds like puppies and kittens get the worst of it.
They absolutely do, especially with Toxocara, because of those ways they get infected from their mom, even before or right after birth. So you see the whole package.
Yeah.
The pot belly, the poor growth, the vomiting, maybe with visible worms, the diarrhea, maybe the cough, just general discomfort. You can see it affect a whole litter sometimes.
And Adult animals?
Yep.
Are they usually okay?
Adults often don't show obvious signs, especially if it's Toxascaris or just a few Toxocara. They might have developed some immunity. If they do show signs, they might be more subtle. Maybe the coat's just not quite right, slight weight loss, occasional soft stool. But, if they get a really heavy burden, adults can still vomit, have diarrhea, and pass worms too.
Okay, so if you see these signs or you're just doing routine checks, how do vets actually confirm it's roundworms?
The standard method, the sort of gold standard, is a fecal flotation test.
Right, checking the poop for eggs.
Exactly. You take a small fecal sample, mix it with a special dense solution, often a sugar or salt solution, and the idea is that the worm eggs, being lighter, will float to the surface. You collect a drop from the surface and look at it under the microscope.
And can you tell which type of roundworm it is from the eggs?
You can. The sources point out the differences. Toxocara eggs are generally roundish oval. They've got this thick, rough-looking shell that's often described as pitted or bumpy, and the inside looks dark and granular.
Okay.
Toxascaris eggs are also oval, but their shell is smooth and thinner. And the inside cell often doesn't quite fill the egg, so they tend to look lighter under the microscope. Those differences are key for identification.
But there's a catch with this test, right? Especially in young animals. The sources mentioned a limitation.
A really, really important one. It's called the pre-patent period.
Me-
It's the time gap between when the animal first gets infected and when the worms inside them actually mature enough to start producing eggs that show up in the feces.
Ah, so they can have worms, but no eggs yet.
Exactly. For Toxocara, this pre-patent period is typically around 2 to 4 weeks. For Toxascaris, it's even longer, maybe 5 to 8 weeks. So a puppy could be really sick, full of worms causing problems, but still test negative on a fecal float because the worms aren't laying eggs yet.
That seems like a major hurdle for diagnosis.
It is. And that's why the sources universally recommend presumptive treatment for young animals, basically deworming them based on their age and high risk, even if a fecal test comes back negative initially.
Makes sense.
Plus, egg shedding can be intermittent sometimes, and how well the test works depends a bit on the technique. Using a centrifuge for the flotation is generally more sensitive than just letting it sit.
So besides the fecal test, how else is it diagnosed?
Well, often it's a presumptive diagnosis based purely on those classic signs in a young puppy or kitten. The pot belly, the failure to thrive, the vomiting worms.
Yeah. Right, if you actually see the worms, that's pretty definitive.
Can't argue with that. Seeing those spaghetti-like worms in vomit or feces is diagnostic gold. Doesn't get clearer than that.
Okay, so once it's diagnosed or you're doing that presumptive treatment in a puppy, what's the plan? How do you actually get rid of them?
Right. Treatment. The goals are pretty clear. Kill the adult worms living in the gut, stop the pet from shedding more eggs into the environment, and basically break that cycle of transmission, especially from mother to offspring.
And how do you kill the worms?
Dewormers.
Yep, anthelmintics is the technical term. Dewormers. The sources list quite a few effective ones. Pyrantel pemote is very common, especially in young animals because it's quite safe. Fenbendazole is another important one. Good, because it can also kill some of the larval stages, including those dormant somatic ones sometimes.
Oh, interesting.
And then you have ingredients like milbomycin oxum, moxidectin, selamectin. These are often found in those monthly heartworm and flea preventatives that also cover intestinal worms.
Is it usually just one dose and done? Rarely, especially not in puppies or kittens. Because of that constant potential for reinfection from the mother via milk or larvae maturing at different times, you need repeated treatments. That's where those deworming protocols come in.
The ones starting really young.
Exactly. The standard recommendation you see across the sources is start deworming puppies and kittens at 2 weeks of age. Repeat it every 2 weeks until they're 8 weeks old. Then switch to a monthly dewormer or broad-spectrum preventative, continuing that until they're at least 6 months old.
Wow. Every 2 weeks for the first couple months. That sounds like a lot.
It does, but it's crucial. You're catching the worms they likely got from their mother, and you're catching worms developing from eggs they might ingest before those worms mature and start dumping huge numbers of new eggs back into the environment. It's about interrupting the cycle early and often.
Okay. What about adult pets?
For adults, treatment is usually based on finding eggs in a fecal test. But even then, because a single dose only kills the adult worms present at that time, a follow-up dose is often recommended 2 or 3 weeks later. That catches any larvae that were migrating or maturing during the first treatment.
And for ongoing prevention in adults.
Regular strategic deworming, say, every 3 to 6 months, depending on lifestyle and risk, or, more commonly these days, using one of those monthly broad-spectrum preventatives that covers roundworms is the way to go, especially for any pet that goes outdoors.
Can you deworm pregnant or nursing mothers to reduce the risk to the pups or kittens?
Yes, definitely. Strategic deworming of the mother late in pregnancy and/or during lactation is recommended in the sources. It can help reduce the number of larvae passed across the placenta or through the milk. Fenbendazole is often used for this because it has some effect against those reactivated somatic larvae.
Makes sense. Now, besides the medication, what about the environment? You said those eggs are tough.
Incredibly tough. That's the challenge with environmental control. The single most important thing is prompt fecal removal, daily cleanup. Remember, the eggs need those weeks outside the body to become infectious. If you pick up the poop right away, you remove the eggs before they can activate.
So scooping the yard or the litter box daily is huge.
Absolutely critical. Basic cleaning helps too, of course, but the sources are clear. Regular disinfectants don't do much to Toxocara eggs. There's really thick protective shell.
So bleach isn't going to cut it.
Probably not for the eggs, no. Things that do work better are extreme heat, like steam cleaning concrete runs, or maybe boiling water if feasible and safe, or prolonged exposure to direct, strong sunlight in drying conditions. But that's hard to achieve consistently in, say, a grassy yard.
Tricky.
Yeah, and controlling rodents and other potential paratenic hosts is also part of the puzzle, especially for pets that hunt. Less prey means less chance of infection that way.
Okay, so summing up prevention overall.
It's really a multi-pronged approach. Follow the vet's recommended deworming schedule for young animals religiously. Use a good monthly broad-spectrum parasite preventative for adults. Practice rigorous hygiene. Pick up that poop immediately. And get regular fecal exams done, maybe once or twice a year, just to monitor things. Consistency is key.
Right. Now let's shift gears a bit to what might be, honestly, the most important part of this whole deep dive for you, the listener, the public health side. The zoonosis.
Yes. This is where knowing about roundworms goes beyond just pet care. As we said right at the start, and it bears repeating, Toxocara canis from dogs and Toxocara cani from cats are zoonotic. They can infect people. Toxascaris leonina is not. Craw.
Okay, crucial difference. How do people actually get infected with Toxocara?
It's almost always through accidentally swallowing those infective eggs that have been sitting in the environment.
In contaminated soil.
Exactly. Think yards, parks, playgrounds, sandboxes. Places where infected dogs or cats may have defecated, maybe weeks or months ago. Young children are at the highest risk.
Why them particularly?
Well, they play in these potentially contaminated areas. They're more likely to put dirty hands or objects in their mouths. And some young kids actually eat soil that's called geophagia.
And what happens if a person swallows those infective eggs? The worms don't grow into adults in us, right?
Correct. Humans are what we call an aberrant or dead-end host for Toxocara. The larvae hatch in our intestines just like they would in a dog or cat, but they can't mature properly. Instead, they start migrating through our body tissues.
Like the somatic migration in pets?
Kind of, yes. But because they're on the wrong host, they tend to get lost and wander, causing inflammation and damage wherever they go. They trigger the immune system, which forms little inflammatory nodules called granulomas around them. This whole process can lead to two main syndromes the sources describe.
Which are?
Visceral larval migrans, or VLM. Visceral meaning organs. This is when the larvae migrate through internal organs like the liver, lungs, sometimes the brain. Symptoms can be vague fever, coughing, abdominal pain, and depend on which organs are most affected and how many larvae are involved.
Okay, that sounds unpleasant. What's the other one?
Ocular larval migrants, or OLM. Ocular meaning the eye. This happens when a larva, sometimes just one, happens to migrate into the eye.
Into the eye itself. Ugh.
Yeah. And this can be really serious. The inflammation and damage caused by the larva in the eye can lead to vision problems, even permanent vision loss, often just in one eye. It's a major concern, especially because it can sometimes be misdiagnosed as other serious eye conditions, like retinoblastoma, a type of eye cancer in children.
Wow. So preventing this in people comes right back to managing the worms in our pets and cleaning up the environment, doesn't it?
It absolutely does. Human prevention hinges on breaking that cycle. Strict hygiene is number one. Wash hands thoroughly with soap and water after playing outside, after gardening, after handling pets, especially before eating.
Makes sense.
Teaching kids not to put dirty hands or toys in their mouths, discouraging them from eating dirt or sand. Covering sandboxes when they're not being used helps keep stray animals out.
Oh.
And then the pet side. Diligent, regular deworming of dogs and cats, according to veterinary advice, and that immediate cleanup of pet feces. Reducing the number of eggs going into the environment is the single most effective strategy.
Education seems key too, making sure pet owners understand this risk.
Hugely important. Many owners just aren't aware that their pet's roundworms could potentially pose a risk to their family. It's a crucial part of responsible pet ownership.
So, thinking about the pets again, if they get diagnosed and treated, what's the usual outcome?
For most pets with straightforward roundworm infections, if they get the right deworming treatment, the prognosis is excellent. They usually clear the infection and recover very well.
But what about those really awful cases, the blockages you mentioned?
Right. For those unfortunate puppies or kittens with a massive worm burden causing a severe obstruction, or, God forbid, a rupture, the prognosis is much more guarded. It's a serious emergency, and sadly, it can be fatal even with treatment.
And for humans who get VLM or OLM?
For VLM, the outcome really varies depending on the severity and which organs are involved. It often resolves, but can sometimes cause lingering issues. For OLM, the eye one, unfortunately, even with treatment, some degree of permanent vision loss is common because of the damage the migrating larva causes. Early diagnosis and treatment give the best chance of preserving vision.
It just really drives home that this isn't just some simple pet problem.
No, it really isn't. It's a perfect example of that one health concept, where pet health, human health, and environmental health are all interconnected.
Okay, so let's try and wrap this up. Key takeaways from this deep dive. Roundworms are super common, especially in young pets, spread in multiple ways, including directly from mom.
Right, that vertical transmission is huge for Toxocara.
They can make pets quite sick, from that potbelly look and poor coat all the way to potentially fatal gut problems.
Definitely.
And the big one, Toxocara species, the common dog and cat roundworms, are zoonotic. They pose a real risk to people, especially kids, causing conditions like VLM and the eye condition, OLM, through contact with contaminated environments. Toxascaris, thankfully, does not.
Understanding that life cycle, the eggs needing time to become infective, the pre-patent period meaning early tests can be negative. That's all crucial for control.
And recognizing signs, knowing why vets push for that early and repeated deworming in pups and kittens, keeping up with fecal cleanup, and using regular prevention, those are the cornerstones.
Absolutely. It's about consistent management.
This deep dive really makes it clear. Managing roundworms isn't a one-off fix. It's continuous, and it's tied so closely to their life cycle and how incredibly persistent those eggs are in our shared spaces.
Exactly right.
And maybe here's a final thought to chew on, thinking about those sources. Just how long can those microscopic Toxocara eggs survive out there? In the soil, in the yard, maybe even cracks in the patio?
Months, potentially years, under the right conditions. They're astonishingly resilient.
So what does that really mean for the places where our pets hang out, where our kids play? It kind of shifts the perspective, doesn't it? Maybe it's less about just treating infections as they pop up and more about embracing continuous prevention, the regular deworming, the hygiene as just a fundamental part of having pets. Because the environment itself can remain a source of risk for so long. It's a quiet challenge, always there, but one we can definitely manage with the right knowledge and consistent effort.